Hi, my name is Lisette. Before we go into our session today, let's go over a few housekeeping items. We are offering today's session in closed caption. You will see controls for the feature at the bottom of your screen. You can simply hover over live transcript to make changes to meet your needs. Unfortunately, we are unable to accommodate AI note takers within Zoom due to cybersecurity reasons. We will have to remove them as attendees. Please accept our apologies for any inconvenience. This meeting is being recorded. Please do not share any important or personal information during our session. Please do not share any, partner staff is available for individual issues if you may want to discuss. We will share contact information for member engagement later in our presentation. The recording of this session will be available on our website at www.partnersbhm.org. Type Member Café in the search bar located at the upper right for easy location. We will also be sending you a follow-up email with the slides and other materials. Let's look at the Zoom features located at the bottom of your screen. Chats is open for engagement during our session. Q&A is open for you to enter questions as information is being presented. We will moderate questions at the end. Reactions is available to send up positive emojis to raise your hand during the question time, and we will open your mic for questions or comments. At the end of our session today, we will ask you to complete a survey. This information is very important to us. We appreciate you taking a few minutes to complete the survey. Let me now introduce to you our guest speaker for today. Kenny Gibbs was born in Fayetteville, North Carolina. He is a certified rehabilitation counselor and serves as Assistant Division Director for Vocational Rehabilitation Services. Kenny's greatest passion is evidenced by his chosen career path, which is serving others. Our next presenter is our very own Joe Ward. Joe is a competitive integrative employment coordinator who works with our community living director, Doug Gallion. He is a father of two beautiful girls, enjoys sports and watching his kids play ball. Joe has worked in the field for 15 years. During hockey season, we can catch him cheering on the Carolina Hurricanes. With no further ado, please welcome our first speaker today.
Good afternoon, everybody. I guess I need to update my bio to reflect our name change for our division, Division of Employment and Independence for Persons with Disabilities. So we'll start out today and looking at the goals, our goals, and the way we support individuals who apply for services. If you move to the next slide, please. So the learning objectives, we'll move to the next. So we want to learn about EIPD resources. We want to learn how we help eligible clients. And the third thing is learn how to refer someone to EIPD. Next. And we'll move on from there. We'll talk about the mission. So our mission is to promote competitive integrated employment and independence for people with disabilities through client partnerships and community leadership. Next. So the EIPD funding is primarily a match, which a lot of our DHH programs are, between our federal partners and our state partners. The match is approximately 78% of our total grant is federal, and then 22% is a matching state match that we have to receive in order to pull down to 78%. EIPD's independent living and assisted technology programs, which are two other programs that we operate, those are funded through state grants through the administration of community living. So those are 100% state grants. This map here just shares with you the regions. We are divided into 3 regions, and this is how we provide state coverage. We have a western region, a central region, and an eastern region. We provide services to all 100 counties in North Carolina. Next. So the services we provide, So the Federal Rehabilitation Act of 1920 was created a program to help civilians with physical disabilities retrain and find employment. Over time, eligibility rules and services were expanded to help more people with disabilities in more ways. The North Carolina Department of Health and Human Services is the administrator of state vocational rehabilitation, independent living, and assisted technology grant programs. So we fall under DHHS. Next. In April of 2024, North Carolina Division of Vocational Rehabilitation Services transitioned to the Division of Employment and Independence for People with Disabilities, a new name that better reflects our work and services. Our name change celebrates the potential and accomplishments of individuals with disabilities and their journeys to independence. We collaborated with our clients, the staff, and partners to develop a new name and ensure it actually captures clearly and clearly explains our mission and the spirit. Next. So now we're okay. So we help people overcome disabilities, related barriers, and achieve their goals for employment and more independent living. Next. This graph here basically shows you a client demographics. This is some of the demographics of the individuals that we serve. And as you can see here, majority of the individuals that we serve have cognitive or are on the autism spectrum. And then you look at persons with social and emotional, which could be mental health types of issues, and then physical disabilities. And then a small percentage of individuals we serve are deaf or hard of hearing. The age groups you can see here, the breakdown there for the age group, with the majority being between the ages of 25 and 54. Next. This demographic here takes a little deeper dive and it looks at some of the specifics of the individuals we work with. So if you see, as you see here, two or more of the individuals, or 56% of individuals have two or more disabilities. When it comes to male and female, we have about 45% are female, 52% are white, 53% are any minority, 45% are black, and 7.4 are Hispanic. Next. Other barriers that we serve, or barriers that people bring to the table that we serve, you've got long-term unemployment. It represents about 52%, 53% of the individuals we serve. Low income, about 50%. Low literacy is about 30%. Ex-offenders is about 11.9. Single parents is about 5%. Homeless population is about 3%. Foster care youth is 2%. And then perceived cultural barriers is 3.2%. Next. So vocational rehabilitation program, we provide counseling and assessments, training and on-the-job experiences, job search and placement assistance, and many other services depending on the individual's unique needs and employment goals. It's important to realize that all services are sort of catered to the needs of the person. So not every individual, even if they have the same disability, receives the same types of services. It just depends on what the individual need is and how the disability plays itself out and the type of barriers that it presents to employment for the individual. Next. So how EIPD can help, and these are some examples. If you have a person with, for example, no work experience, we can help that person identify a career goal and get their first job. If a person is returning to work, we can help you go back to the same job or find a similar job. If you're at risk of losing your job, we can help you overcome barriers and keep working. Next. So the process steps for employment success, and there's primarily 6 steps that a person must go through in order to benefit from EIPD. The first is a referral. The second is the actual application that's taken. Then we determine the eligibility for the individual. Then a plan is developed. Then we go into the services that are part of the plan. And the last step is competitive integrated employment. Okay. So this is the timeline from application to actually employment. So typically we have by federal law up to 60 days. So within 60 days, we have to take an application on that actual individual and establish their eligibility. And then you have up to 90 days to actually develop the plan of services for the person. And with that, there's several steps that have to be taken to try to identify what type of job and how the disability plays itself out, and the type of job the person best matches up with. Um, and then from there, you move into case closure. Case closure takes place when the person is successfully employed, has completed their plan, which could involve training or other types of services, and works on the job for a minimum of 90 days. Next. Um, so some of the partnerships that we have, we collaborate with disability service providers, local and national employers, workforce systems, and other community partners to support job seekers with disabilities and connect them with careers. Next. So who is eligible for EIPD's VR services? One is an individual who is a legal resident and at least 14 years of age. Individual wants to pursue employment. The individual faces disability-related barriers to employment. Uh, EIPD services can reduce or eliminate these barriers for an individual. Thanks. So eligibility for Social Security beneficiaries. If an individual receives Social Security Disability Insurance, SSDI, or Supplemental Security Income, which is SSI, they are presumed eligible for our services. What we do then is work with, or that person will work with an EIPD counselor, and the individual will pick an employment goal and will develop the individualized plan for employment. So there's a presumed eligibility, but we still have to work with the person in trying to determine the type of job that works best for them and how we'll actually serve that person. So SSI and SSDI beneficiaries will be also referred to our benefits counselor to discuss how earned income can impact their benefits. EIPD will include documentation of individual disability and barriers to employment for their case file. So we have to collect information and document the type of barrier in order to determine the eligibility for the services. Next. Examples of disability types. So we work with individuals with cognitive and developmental disabilities, and there's a list here that describes those types of disabilities. Physical disabilities, the list here describes those types of disabilities. And then there's mental and behavioral health disabilities. And then there's sensory disabilities, which is hearing, vision, and speech impairments. Next. So employment models. So when we look at employment models, there's a couple that we utilize in assisting persons to achieve employment. First, there's a self-employment model, and typically EIPD helps individuals with disabilities who want to pursue employment and with existing employer, but some small number of clients are interested in starting their own business. Um, and for those individuals, EIPD can provide some modest support to help launch a new business or strengthen an existing business for eligible clients. Um, this is not a grant or a loan. These are services that we provide through our basic support grant to assist them in these areas. And some of the services may include creating a business plan, evaluating the feasibility of a business plan or business, what supports and funding is needed from EIPD, uh, the client's contributions, their financial eligibility, and then the actual approval process. Next. So self-employment resources. There are small business centers that can help entrepreneurs with disabilities. We strongly encourage clients interested in self-employment to seek help from the small business centers, which are SBCs, or SCORE, which stands for Services Corp of Retired Executives, or North Carolina Small Business Development Centers. These agencies can assist individuals in exploring their business model, business plan, and financial projections. Next. So one of our other programs is called Independent Living, or we refer to as IL, and then there's a North Carolina Assistive Technology Program, which we refer to as NCATP. Next. So our IL mission and the services, the EIPD Independent Living Program supports community living and independence for persons with disabilities based on the belief that all people um, can live with dignity, make their own choices, and participate fully in society. The IL program provides person-centered services to approximately 2,000 people annually, focusing on deinstitutionalization and independence for people with disabilities. So not all folks come out of institutions. In some cases, we're working with individuals to prevent them from going into institutions. We're doing home modifications and doing various things to make their home more accessible and allow them better access to the community to be able to, live a more full life. Next. So our NCATP mission and services, and I apologize, this slide, the wording on it is kind of small there. So North Carolina's Assistive Technology Program, which we refer to as NCATP, is a state and a federal funded program that provides assistive technology services statewide to people of all ages and abilities. The NCATP program leads North Carolina's efforts to carry out the federal 21st Century Assistive Technology Act by providing uh, device demonstrations, short-term device loans, and reutilizations of assistive technology. They assist over 12,000 people with disabilities annually as they increase their independence through the use of assistive technology. Next. So the employment initiatives. We have a program that is a grant-funded program. It's a 5-year grant, and we're in year 4 of that particular grant, and it's called Spark. Uh, uh, and this update is as of May of 2025. So right now, Spark is working with 85 clients. They've done 13 successful closures. Spark provides education, training, and support to help people explore, prepare for, and transition into competitive and integrated employment. Um, this was established through a 3-year through 3 pilot sites. And the pilot sites that we currently have are with Wake Enterprises, Chatham Trades, and Tri-County Industries. All of our pilot sites hired and trained staff, engaged in ongoing outreach to enroll participants. Participants are encouraged to join the Stakeholder Engagement Advisory Group. Um, and the new SWISI grant director is Shane Rose. Next. So one of the other programs is called Bridges to Success. Um, and this update was provided also as of May of 2025. So with this grant, we work with the North Carolina Community College system. And through this grant, the system, we embed EIPD staff in community college to specifically assist students with IDD applying for and assessing VR program services. There's 6 temporary VR case managers that are located with these on these community college campuses, and it's funded um, by fall of funded through fall of 2023 General Assembly as a 2-year pilot, and it ends in 2026. The community college sites are Alamance Community College, Asheville Buncombe Community College, Brunswick Community College, College of Albemarle, South Piedmont Community College, and Wilkes Community College. Next. So disability benefits is one tool that we use um, to assist individuals, and this can be anyone in North Carolina who's receiving SSI or SSDI. This is a public website that we've actually purchased, and the website address is listed here. And this is to assist individuals with disabilities and service providers understand the connection between work and benefits. DB 101 provides information in plain language and simple tools to help dispel myths and reduce confusion around public benefits, earned income, health insurance, and more. This website provides a safe harbor. There's no personally identified information. It is user friendly. There's an estimator that helps you, uh, that demonstrates your benefits and the work programs and how it actually works. And currently, this program is also available in other states as listed here. And North Carolina was one of the more recent states that purchased this software application to use for North Carolina citizens. Um, and EIPD sponsored this, and we purchased this system. So the featured disability calculators, uh, this is one of the things that most people go to because it actually shows them they can plug in their wages, their current wages, and it'll tell them how those wages are actually impacted by employment, the amount that you can make, and then how that actually impacts your employment. So that program went live in May of 2025. Next. So there's also pre-employment transition services. And 3,215 students first enrolled in pre-eds on the initial enrollment when we first received this particular initiative through our funding source. Uh, 10,283 total students enrolled in pre-eds, including carryover. So that's about what our numbers are now from when we first started with the actual program. Next. So working with inclusive work. So this one deals with CIE and our outreach team. CIE is competitive integrated employment. So working with inclusion works. This program helps to support those with IDD who are working in non-CIE, but are saying that they do want to work in competitive integrated employment. This team has now been trained and is working on teams alongside CIE coordinators, competitive integrated employment coordinators from our LME MCOs. Um, and this is a great partnership, and we are hoping to help make sure that these folks are getting the resources that they need. We have 43 referrals that have been received so far, and we're excited about and hopeful that we will be able to help more people reach their CIE goal, which is competitive integrated employment. Okay. And then one of our other programs is our NCATP, North Carolina Assistive Technology Program. And I won't attempt to read all of that because it's even small for me. But 575 attended the 2024 NCATP Expo. They have an expo each year where they actually demonstrate, they have various vendors there, the different products that are available in the way of assistive technologies for individuals with significant disabilities who need this technology to be able to access their community, go to work, and just for everyday living. They just recently finished one earlier this month as well. We don't have those numbers as far as attendees go as of yet. Next. All right. So this presentation was put together by Kathy Smith, who is our division director. And her information is listed here for any questions that anyone has about EIPD or any of the other services that we provide. Okay. Next one, please.
Okay, so I guess I'm next. I won't keep everybody very long on mine because Kenny did a very good job on his slides and hit a lot of the key points in this PowerPoint. But I'm Joe Ward. I'm the CIE coordinator here at Partners. We have just got this program started less than a year ago. We're currently serving, I want to say, about 6 referrals right now through our partners catchment, but we have a whole list that we go through. If you want to move to the next slide, we'll get started on discussing about that. Kenny already spoke with the initiative to promote competitive in employment for across the state. Doug and I really took the approach that we want to make sure everybody has their voices heard. With my 15 years of experience in the field, I've worked on the provider side, worked on the innovations waiver, and just from my experience, the biggest thing is we want to make sure that folks their voices are heard and they have informed choice. If they want to work, they have the opportunity to work. And that's pretty much what the CIE emphasis is. Everyone has a right to work in an integrated setting for fair pay if that's their choice. Next slide, please. Kenny went over the CIE and what it means. CIE is for everyone. North Carolinians, even those with most significant disabilities, can work in CIE with the right job supports in place. We're really trying to get with our providers and making sure that they understand that with our legacy folks, they may change their minds, and just because they've been in a setting for 20, 25 years doesn't mean that they're not capable of working. And that's really what our emphasis had been on the last couple of months, is looking at those legacy folks and seeing if we can't find any work opportunities for those folks. Next slide, please. The informed choice is important for our folks. I think Kenny discussed a lot of this about starting with the referral process and doing the assessments and the time period of which it takes for a VR counselor to get back with folks and making sure they're in the right appropriate setting and have the appropriate supports in place to be successful. Next slide, please. Again, Kenny discussed a lot of this. You got your VR services that have the EIPD, career counseling, employment assessments, job training, job placement assistance, assisted technology. I believe he went over that. But again, a lot of this is repetitive, but any questions regarding this, I'm sure Kenny or I can definitely assist y'all moving forward. Next slide, please. Supported employment. So here's a big thing that Doug and I are really pushing is VR ultimately is the initial step, but it's not the long-term step. After an individual is placed with VR, they're going to come back to us for long-term care. And if they have Medicaid, obviously that can be through our 1915I services. We are looking about getting our in lieu of and ADV folks switched over to 1915I, so they have different Medicaid options for them. But again, the VR is the starting point, and we're kind of the follow-up and long-term support. And next slide, please. This is just information about the strategic plan. Kenny pretty much wrapped all that up in his PowerPoint, but it's pretty much the state's making the initiative to supports for individuals with IDD, even TBI, and aligning evidence-based and promising practices to promote informed choice towards successful transition to CIE. Next slide, please. Again, the assessments have been done for our legacy folks. Doug and I've made a emphasis, and I don't know if the state's there yet because we're kind of building this program as we go, but we're really looking, partners is really looking at those pre-ET students as well, because we feel that sometimes there's some miscommunications once they finish their school and they go through the pre-ET program. We want to make sure that they have every opportunity available for them, whether it's supported employment, whether it's continued secondary post education, or whether it's just linkage to services through partners. So we want to make sure that our folks are being served and not falling off the cliff per se. And to do that, we have to get our providers on board too, of helping us recognize folks when they have individuals come through the schools to tour their facilities. We've been asking our providers and schools to ultimately give us names and contacts to make sure that we have them already in our system, making sure that they have the necessary supports and signed up on the run to make sure that that they're on the list for different services when they come available. Next slide, please. Data collection. So every quarter, providers across our regions submit their quarterly CIE data. This shows who is currently in CIE employment, who has not in CIE employment, who has requested that they are okay with not pursuing CIE, ones that are pursuing, how can we best support them, set them up with the right agencies, providers, so they can be successful. So that is an ongoing thing that the state requires through the LMEs and providers. So if you're a provider and you get this report, that's what it is. We're just collecting the data to make sure that nobody goes unserved. Next slide, please. This is Doug and I's information. Again, Kenny went over a lot of information today, very informative for everybody. And I'm sure that he could answer a lot of questions as well. But here's Doug and I's contact information. If you have any questions, please reach out. We'll be glad to get back in touch with you. Thanks.
Thank you so much, gentlemen. This was absolutely great information and very encouraging. And to those who logged on today, again, thank you for attending Member Cafe and for sharing your time with us. As I mentioned at the beginning of our session, we have partner staff available for individual issues you may want to discuss. You can reach the member engagement team by sending an email at memberquestions@partnersbhm.org.
Hey, Lisette,
Mhm.
let's go. We do have a couple questions in the Q&A, so
Okay.
we're going to go over those real quick before you do that.
Okay, good afternoon, everyone. Thank you, Mr. Gibbs and Mr. Ward, for your presentation. So now we're going to take a few minutes to see if we have any questions and answers, and it looks like we do have several in our Q&A. As said earlier, feel free to raise your hand and we'll take you off mute, or you can enter your questions into our Q&A. So our first question looks like it goes to you, Mr. Gibbs. Is vocational rehabilitation a program under the Employment Independence for People with Disabilities?
It's actually just the opposite. So vocational rehabilitation is a big umbrella, and employment and independence for persons with disabilities is one of the programs under vocational rehabilitation, just like the other programs that were described, the independent living program, the assistive technology program, and a couple others. But it still works the same way. We just did a refocus to help folks really understand what we do, because so many people confused us in the type of services that we provide with just specific populations. But we did that to help people better understand what we do and what our goal is.
Great, thank you. Looks like we have another question. Can you talk about working with a benefits counselor, and are they available to the person for ongoing questions about continuing to work and keeping their benefits?
Yes. So the benefits counselors, and this is in addition to the DB101. So the DB101 is a software application that's out there. You just Google DB101 and it'll pull up. And that's more of a self-directed benefits guide where you can ask questions. The benefit counselor really takes a deeper dive. And typically they're for individuals who are seriously contemplating going to work but receiving SSI or SSDI, are working, and maybe they're looking at promotion, they're looking at other things, or and they want to know how it's going to impact their benefits. Also, a lot of parents utilize DB 101 and the benefits counselors to help, make decisions on how work will impact the resources, both on the medical side as well as the check side of things for them.
Okay. Looks like we might have one. Terry, I think might want to come off mute. If not, I'll go ahead. I'll go ahead and repeat the question. In regards to receiving services with the CRP through EIPD, moving into long-term follow-up services, as a CRP, are they required to provide long-term follow-along services? And how do we as CRPs receive funding for providing those services, and how do we connect our individuals to qualify for those services?
Okay. So the CRPs, community rehab programs that work with EIPD and have a contract with EIPD for supported employment services, they are required to provide the long-term supports. That funding typically comes through the LME or MCO. Obviously, there are some limits on that funding. But yes, under our contract, they are required to provide that for supported employment. Now, there's another model most of our CRPs are familiar with it, and it's called work adjustment. And work adjustment is not as intense as supported employment, because that's one of the beauties of supported employment is that you got that indefinite long-term follow-along. And it's a more intense program for persons with more significant disabilities. If they look at just work adjustment, we call work adjustment job coaching, the person may not need the long-term follow-along. They may not need job coaching services as long, but they do need someone to get in there and work with them and help them figure out how to best do the job given their restrictions and limitations. So that is an option as well, which doesn't require the long-term follow-along. But when it's supported employment, long-term follow-along services are required per our contract with the CRPs or community rehab programs.
Okay, looks like we have several other questions. How many individuals with IDD, which is intellectual developmental disability, have been placed on jobs after going through EIPD?
I don't have those exact numbers, but if you remember the breakdown I gave you as far as the individuals that are actually served, it is a significant number of individuals because we've served, majority of individuals that we serve are IDD. And we close anywhere from 4,000 to 5,000 individuals per year. And a good percentage of those individuals are IDD. A lot of our IDD consumers are also served through community rehab programs. And our community rehab programs are responsible for about 40 to 50% of our successful outcomes. So that gives you some idea. I don't have the exact numbers, but that is available through our annual report. So if someone wants to email me directly, we can certainly, or Kathy, we can get you that information.
All right. The next question is, how long does it take an individual with intellectual developmental disability to go through the process with voc rehab before actually being placed on a job?
That's a good question, and it's one that we get quite a bit. A lot of people struggle with the rehab process, the eligibility process, development of the plan. And it's important to understand that what we're looking at, and many times people have had situations where they found a job or they worked with another entity that just found them a job and it was pretty quick. What we're trying to do is go through a complete rehabilitation process with that person and help figure out, so why is it that they've had several jobs but none of them ever work out? What is the best fit for that person? How does their interests and abilities actually match up? So you're going through a process of trying to develop a good solid plan for a job that hopefully leads to a job there where you can support yourself in. It's a long-term kind of job. Although we have some individuals that are receiving SSRS, SDI, and they're only interested in part-time employment. But the same eligibility criteria I described in the presentation applies. It's up to 60 days to determine the eligibility for the person. And then after the eligibility, it's up to. Now, just because it says up to 60 and up to 90 doesn't mean we take 60 days and 90 days each time, because you're already, you're looking at 5, 6 months just in that part right there before you even get to the job. And for some individuals, it goes a whole lot quicker than that when you have the information we need to establish the eligibility, or it's a very clear job path for that person, and we don't have to do a lot of the exploration and the other things. So that process is, once again, up to 60 days for the eligibility, up to 90, not to exceed the 90 days in establishing the actual plan. And then once you get there to the plan, it depends on what the services are that you need that leads to employment as relates to the full length of time it may take.
Okay.
So it just varies.
Thank you. We have another question. Looks like someone wants to know if we will receive copies of the presentations and contact information. Yes, following the presentation, there will be a follow-up of emails with slides and materials and presentations and contact information of the presenters. Another question, how do you work on establishment of a network of employers that will hire individuals with intellectual developmental disabilities?
Okay. So we have about 85 what we call business relations reps across the state that serve in all 3 of our regions and all 100 counties. And they're basically trained to do job development and placement for individuals with disabilities. So they work with employers. We use various incentive programs that we have, such as on-the-job training, the supported employment program, which is another form of support that we offer to employees that can feel comfortable with working with an individual with a disability and training them. And a lot of it's just through developing relationships, through chamber events, through doing a lot of cold calling and working with employers and helping them to understand the abilities of individuals with disabilities, not so much the disability itself. And we find, quite a bit of success with that when we're able to do that job match, because that's probably the biggest key for a lot of employers, is finding someone who's capable of doing the job and finding that match. And then the supports that we provide to employers for that individual when they're on the job, either support employment or work adjustment, or being able to touch back base with that business relation rep if there are any issues or problems that need to be worked through. So those are the things that allow us to be successful in working with employers and appropriately marketing the abilities of individuals that we work with that have disabilities.
Okay, and to our previous question, I think we're going to be dropping in our chat the contact information for our presenters. But then afterwards, we will still be following up with an email with the materials and slides. Our next question is, we have several individuals with 1959 benefits for supportive employment. Partners UM Department is requesting letters of denial from the Employment Independence for People with Disabilities for these individuals. Is there a process or contact person to obtain such letters?
I believe that's for partners, right?
Yeah, so they should be requesting those through their local VR office. Typically, how that's done is before somebody seeks out supported employment, we do request that they go through VR. If they've not done that and they've got a job, we just need to make recollection of it that that VR has, agreed with the employment, agreed that that they've did. I don't really know the terminology. Kenny, do you know what the terminology of VR's letter that they would use for the unplacement or whatever it's called?
Not, no, I could take a stab at it, but to be 100% honest, I'm not familiar with the.
They would need to get some form of written notice from VR agreeing with the employment. That's my understanding. That's what we've been told on our end. If that's not correct, we can definitely drop back and punt and get some clarification from UM. But from my understanding, if they already have employment, that should not be a deal breaker for EM to be approving 1915I supported employment.
Unless it's a certificate of eligibility that notes that the person is eligible for VR services.
All right, our next question, I think this is for you, Mr. Ward. Can you give an example of when a person will get referred to competitive integrated employment versus employment of independence for people with disabilities?
Yeah, so right now, like I stated earlier, we are really keying in on the legacy folks that's at our day programs that's been receiving day supports, day activity, those type of services. We are seeing if they want to entertain employment again. Those are the folks that we've identified. We're finding out that after our initial push at these providers, there's been members coming up after the fact showing interest. So we're kind of backtracking a little bit on those folks. But the key focus right now is the legacy folks. But like I said earlier, Doug and I are also wanting to make sure that the school kids that's graduating school are not being lost in the shuffle, even though they're going through pre-ets. We want to make sure that they follow through with the VR side if they want to work. And if they don't want to work, we also want to make sure that we get them linked up to the right services or post-secondary education.
Thank you. Our next question is, where do we get the forms to start the assessment process?
Is that for EIPD or for
I'm assuming for EIPD.
the forms to start the assessment process?
Yes.
Well, it depends on what assessment they're speaking of in the form. Because when a person applies for service, and we have all the paperwork that's there. Now, they're talking about a provider that is trying to refer a person on to EIPD, but the forms that we require, we would have those when a person sets an appointment for an intake, an application for services, and things along that line.
Okay. Are these services available to people who have received the waiver, or are they available at any time?
Is that for Joe or for me? Not quite sure.
So I can answer for CIE. So unfortunately, innovations waivers, we are not addressing those folks through CIE due to that they have a care manager already assigned to them to the waiver that would link them up with supported employment opportunities with providers that's contracted through waiver services, or they still have the option to go through VR, but right now, as partners, we are directing the care managers to do the linkage with providers that's contracted with innovation waiver services.
Okay. Looks like we have a couple more questions. This is for you, Joe. Obtaining a denial from your local VR is time consuming and has no value in actually finding a job for someone with intellectual developmental disability. Why is this step necessary for providing supported employment for an individual with 1915I funding?
That's a good question. It may be that it's just in the state definition for the 1915I services. If it's not, I would definitely reach out to your provider network specialist and see if they can get some clarification with UM on why it's required. My personal opinion, if they've already got a job and has already been approved before for supported employment, it shouldn't be a deal breaker for them to continue to receive the services. But again, I would definitely get with your provider network and see why that's a necessary requirement for 1915I services. It may be that it's a state requirement that's in the service definition. I'm ultimately, I don't know the exact answer for that, but that would be my assumption.
Okay, thank you. And it looks like we might have had a question pop up in the chat. Mr. Gibbs, I think you might have already answered this, but I'm going to repeat it again. How does someone get started with the process for the employment independence for people with disabilities? And I think you maybe covered that earlier in your presentation, and they just want you to elaborate a little bit on that again.
Yeah. So you can apply at any of our offices. There's also, if you go to the website for EIPD, which is under DHHS, there's a way you can do what's called a web inquiry, where you can ask a question and then we'll pass it along to the office that serves the county that you actually live in. And there's also a list of numbers for those offices on the website as well. And you can contact any of the offices to set up an appointment for the initial intake.
All right. I don't see any more questions at this time. I'll turn it back over to Lisette.
Okay. So again, I just wanted to thank each and every one of you for attending Member Cafe today and for sharing your time with us. As was mentioned before our session, at the beginning of our session, we have our partner staff available for individual issues that you may want to discuss. You can reach out to member engagement by emailing us at memberquestions@partnersbhm.org. Your feedback is truly important to us. It helps us to plan for future sessions and learn about what topics interest you. Please take a moment, only 4 to 5 minutes, maybe less, to complete our survey. Grab your phone, open your camera, and hover over the QR code and then click on the link. If QR codes aren't your thing, you can copy the server link from the chat. Member and recipient services, these are our call lines. If you want one number, this is it. They can assist you if you have questions or straight to the specific number, such as member and recipient services, Monday through Saturday, behavioral health crisis line, 24 hours, 7 days a week. Our non-emergency medical transportation, also called NEMT. Schedule your appointment with your doctor, your provider. First-time caller, have your Medicaid ID number. When you call to schedule, have the address of your appointment and time and the address of where you want to be picked up. For our nurse call line, it's a 24-hour, 7 days a week service. Get answers to basic questions or concerns about my health or your health, symptoms or medicines. Teladoc Health. Tailored plan members and recipients have access to Teladoc Health through Partners Health Management. You can speak to a healthcare provider within minutes, avoid waiting rooms and urgent care, and feel better faster. Get care for cold, flu, and allergies, and more. Licensed healthcare professionals are ready to help. Just visit the Teladoc Health to get started or call 1-800-835-2362 for 24 hours a day, 7 days a week provider services. The North Carolina Medicaid Ombudsman Program helps North Carolina Medicaid and North Carolina Choice members understand the Medicaid program and changes happening as the state moves to North Carolina Medicaid managed care. Ombudsman services can help if people with Medicaid have trouble getting access to health care and can connect to resources like legal aid, social services, housing resources, food assistance, and other programs. The North Carolina Enrollment Broker is an unbiased third-party agency that provides information and enrollment counseling to beneficiaries. They help members choose a health plan, will mail notices and enrollment packets to members, and provide choices, counseling, and enrollment outreach. Want to be in the know? Join our email news. Grab your phone, open your cameras, and hover over the QR code, and then click on the link or copy and paste the link from the chat. Enter your information into subscribe and select what type of news you want to receive. And again, as always, thank you for attending Member Cafe today and for sharing your time with us. As I mentioned at the beginning of our session, we have partner staff available for individual issues you may want to discuss. You can reach member engagement by sending an email at memberquestions@partnersbhm.org. We appreciate you taking a minute or two to complete our survey. We look forward to seeing you done. Take care and goodbye.